Good day, everyone. This case presentation is about depressive disorder, subtype, postpartum depression. Before I start, I would like to respectfully acknowledge that I am within the ancestral, traditional, and unceded territory of the Silix Nation. Postpartum depression is a serious illness that can happen in the first few months after childbirth. It also can happen after miscarriage or stillbirth, and it can make moms feel very sad, hopeless, and worthless. And they may have trouble caring for and bonding with their baby. It is important to note that it is not the baby blues, which usually go away within a couple weeks. The symptoms of postpartum depression can last for months. And postpartum depression, or we call it PPD, can also be experienced by the spouses and or related caregivers or relatives. Contributing factors. It seems to be brought on by the changes in hormone levels that happen after pregnancy. Some things can increase chances of getting it, such as having depression in the past, not having good support, or having a lot of stress, which is the case of our patient. So this study reveals the brain changes linked to postpartum.
For your health, postpartum depression affects 1 in about every 7 women who give birth, but not much is known about what happens in the brains of pregnant women who experience it. Dyer is here to break down the findings that really constitutes the first evidence postpartum depression is associated with changes in the brain. Thanks for being here.
Oh, no, thanks for having me. Yeah, this is really interesting because it's an avenue looking at a very common problem.
Yeah, so explain what researchers found.
So what they did is they took 88 women, no history of psychological or psychiatric. They also had a control group of women who were not pregnant. They did brain scans in the 3rd trimester and then in the month after delivering, and they gave questionnaires. All these symptoms basically increased in size in women with symptoms of postpartum depression.
Yeah, getting really scientific here. That's something to do with like fluid in the brain and parts of the brain.
Yeah, and it was volume changes largely due to edema in 2 parts. One was the amygdala, which is involved in processing emotions, and that was in the women with more symptoms of depression in the first month. The other is what's called the hippocampus, increased in size in women who had difficult or very stressful childbirth situations. Size increased. Which direction does the association go? Was it the brain change that led to the emotional issues? Or was there something about the childbirth stress and the emotions that led to changes in the brain? And so that's what we don't know.
Yeah, really interesting. Yeah. Is there anything that we can take from the study that now, women can know what to look out for to maybe, anticipate some of these emotions that they may experience?
Well, I think there's 2 parts. One is that this is the first step in helping us figure out who's more at risk than others. Obviously, all women going through childbirth are at risk. You mentioned 1 out of 7. Narrow that much more down with more information about specifically why some women develop these changes in the brain and some don't. So I think that is potentially helpful. But then even longer term than that, potentially might outline some future treatments, which will be really interesting.
Yeah, of course, everyone after birth experiences this hormone drop. This just adds to the stress of all of that. Thank you so much for being here this morning. Any tips that you can give people when they're talking to their doctors?
Yeah, I mean,
And for the part of the brain affected, amygdala is a part of group of structures deep in the brain that associated with emotions such as anger, pleasure, sorrow, fear, and sexual arousal. Basal ganglia. So some studies have found shrinkage and other structural changes in the basal ganglia in people with depression. Hippocampus. So the hippocampus is smaller in some depressed people, and research suggests that ongoing exposure to stress hormones impairs the growth of neurons in this part of the brain. And neurotransmitters affected, norepinephrine, serotonin, and acetylcholine. When these neurotransmitters become overtaxed through the stressful events, neurotransmitters depletion may occur. And research indicates that stress is associated with a reduction of neurogenesis, which is the ability of the brain to produce new brain cells. For our patient information, Emily Park is a 40 years old female that lives in Keremeos, BC, Southeast Asian descent, single parent of 6 months old infant. She was brought in the hospital by her neighbor friend last 2 days ago, and the doctor diagnosed her of postpartum depression. Her neighbor noticed her crying a lot and seems to be withdrawn to her child. Emily was diagnosed with GDM or gestational diabetes during her pregnancy but was resolved after giving birth. She has no comorbidities in other known psychobiological disorder. For the background, Emily is an only child from a broken family. Growing up, she had to be in between places with her parents. She always wanted to have a complete family for herself. Emily was pregnant during her ordeal separation with her former spouse. Emily was sponsored by her ex-spouse to come into Canada 2 years ago. Her neighbor in the supportive housing is her only nearby support. So she lives in supportive housing provided by the government with finances. She is currently unemployed, currently receiving child support and childcare benefit. So how it is diagnosed. So the doctor will do a physical exam and ask about the mood and symptoms. And it is important for moms to tell the doctors how they're feeling of baby blues during the first checkup after baby is born. And the doctor will do the follow-up after that. And for some doctors, they will use the Edinburgh Perinatal Postnatal Depression Scale, which will be shown in the next slide. For the treatment for PPD, psychotherapy such as interpersonal and cognitive behavioral therapy or CBT, supportive counseling, increased social support, antidepressants, maternal relaxation or massage, hormone therapy, bright light therapy, in some cases, electroconvulsive therapy or ECT. So this is the Edinburgh Perinatal Postnatal Depression Scale or EPDS. This is used between 28 to 32 weeks in all pregnancies and 6 to 8 weeks postpartum. And for the interpretation, scores of 10 or higher generally suggest the need for further evaluation for possible depression. Scores of 13 or higher often indicate a higher probability of clinical depression. Item 10, thoughts of harming oneself, is particularly important. A score of 1 or higher on this item requires immediate follow-up. So for our subjective data, for a patient nearing discharge, I don't think I can do this. The nurse's response would be, that must have been so hard to cope with your current situation. This therapeutic communication skill exhibits compassion, empathy, and sensitivity, acknowledging how patient feels. The use of phrases such as I see or that must have been so hard are effective in making the patient feel understood. Another nurse response is, can you tell me how do you feel now that you are about to go home? So this therapeutic communication skill is questioning the patient. We use open-ended questions when we want to hear the whole story. And after questioning, remaining silent with the patient because there are times when a patient will need to gather thoughts or work to formulate what she wanted to tell you. And what are the patient profile consideration in relation to nursing care plan? The need for medical interpreter if our patients cannot really speak English or it's not their first or second language. Patient demographics because it may influence the response to their instructions. It includes ethnicity and cultural background, socioeconomic background, their age, educational level, and healthcare background. For our priority nursing diagnosis, most of the cases for mental health illness, our priority is their safety. So, risk for self-harm or other, which is the baby related to postpartum depression. Our treatment goal is to ensure the safety of the mother and the child and improve the mother's overall well-being and ability to care for her child. Nursing intervention is to provide education and coping strategies related to the condition. Our evaluation will include the patient will demonstrate at least one healthy coping strategy daily and will verbalize decreased distress. And we will see that patient will connect with her infant. The indication of readiness for discharge, the patient will verbalize ways of how to manage symptoms of depressions, and she will mention the numbers to call when she's feeling overwhelmed. The next nursing diagnosis is social isolation related to lack of available support. As we know, she only have one neighbor for her support. Treatment goal is that patient will not feel isolated, find support, and increase engagement in social and self-care activities. Our intervention is to refer her to a support group, social worker, and provide available resources. And then she will engage and identify support networks, family, friends, and community. And her indication includes she will show interest at meeting and to connect other first-time moms, and she will mention the available resources she obtained from healthcare providers and verbalize how to utilize them, and shows willingness to speak with a social worker. And for our pharmacological intervention, which is citalopram, it is one of the few selective serotonin reuptake inhibitors first choice for treatment of depression and anxiety disorders. It is known to have milder side effects than some other antidepressants. So for our nursing teaching before starting the treatment is to let our patients prepare for the possibility of feeling worse before feeling better and know the supports are available to call when they need it. And when they begin the treatment, they have to monitor their thoughts, moods, and communicate any thoughts of hurting themselves or others with their doctors, crisis line, or emergency department. Common side effects include nausea, vomiting, diarrhea, weight gain, dry mouth, headaches, anxiety, sedation, and decrease in sexual desire and response. This group of drugs may also cause jittery, restless, feeling of sleep, difficulties such as problem falling asleep, waking in the night, vivid dreams, or nightmares. So, is it safe to take antidepressants while breastfeeding? So the amount of antidepressants passed through the breast milk is very small and it is not considered to be risk to the baby. And if the patient decides to stop taking medication during breastfeeding or during pregnancy, it is a good idea to talk to their doctor more often to help them monitor for the return of the symptoms. And for our community health resources, since our patient lives in Quirinias, BC, we have the Quirinias Mental Health and Substance Use, Canadian Mental Health Association in South Conaghan's Milkmean, Postpartum Care in South Milkmean Health Centers. For crisis intervention resources, Penticton Mental Health and Substance Use, Penticton Regional Hospital. This is about 30 minutes drive from where the patient lives. And also, patient can text 988 and the numbers and or text 45645. And of course, for immediate danger, call 911. Summary. So PPD is a serious illness that can happen the first few months after childbirth. It is not baby blues, which usually go away within a couple weeks. It is important to consider patients' comorbidities and related information in developing nursing care plan. Aside from pharmacological intervention, support is necessity for a patient to achieve her health goal. Great resources are available to help. And if you know someone at risk of postpartum depression, refer them to the nearest clinic in your area or call 911. And those are the references. And thank you for watching and listening. Have a great day.